Sarah Chessell. I'm Head of Innovation at University Hospitals Dorset, our recently merged organisation that was Poole and Bournemouth Hospital before. I'm also our General Secretary for the NQICAN network. So this morning, just going to give you a brief overview of our new governance and the forward plan, just by way of raising awareness and just highlighting a few key points that we feel will be helpful for you to know. So going straight to our new governance arrangements, these are a complex set of basically, it's a massive terms of reference that has actually got in there key points that we need to make sure we're adhering to and help support our regional networks that all make up NQICAN. So we had final approval for the new governance arrangements following wide-ranging consultation and discussions both with the NQICAN members, so your regional chairs, the clinical audit and QI community, NHS England and HQIP, so Healthcare Quality Improvement Partnership. Key updates include, and there was wide-ranging discussion and various number of edits, but key updates included core clarification on core and non-core member roles, role descriptions, voting rights, stakeholders and co-opted members. Also about expectations of members, confidentiality and policy of interests and sponsorship, so declaring interests. We also clarified communication, so revised use of social media to help share key messages, and that's really for our members and to promote any posts that are relevant to our work plan as well. So that's a change of our communication. What I want to do is thank everyone for their support and the time that they took to both read the document, to be able to comment on and feedback, because it makes it a stronger governance arrangement which is now in place. So key points just for clarification, and this was a very large piece of work where we actually ended up with NHS England legal team talking about, how are we as a group, and it was clarified we're a non-constituted group made up of these regional network chairs. So we're an independent body working collaboratively with NHS England and HQIP and other relevant organisations. So we influence and support and collaborate. So one of the ones I've been dealing with recently on behalf of NQICAN is requesting amendments to the NACL national audit. Another one that Carl was doing was on the NICOR audit, so the cardiology audit. Our role, and the clarification on our role, is to underpin our common purpose, provide key governance functionality, realise our forward plan and the associated work streams that are agreed with HQIP and NHS England. We encourage our regional chairs to make sure that that voice of the community is heard and brought to us as the NQICAN meeting, and we do question, challenge, encourage the powers that be, so NHS England and HQIP. Other points are part of this large review was actually talking about what we previously called as funding. That's been reclassified as limited reimbursements, and that's an important distinction there. We are not funded. We have agreed limited reimbursements for the year. That's agreed directly with NHS England, but it is sourced through HQIP, who hold that contract, and that's agreed every year. In previous years we have been seeking clarification. It's been really quite difficult, but actually we've had clarification well in advance with regards to our funding for 21-22, which is a fantastic position that helps the regional chairs to know and get support that they need to. We also did some retrospective modelling. Obviously with COVID, the need for face-to-face meetings changed, and we wanted to make sure that our regional chairs were reimbursed, and we managed to get that agreement retrospectively. So those invoices are going through at the moment on proven activity, evidence of meetings that they're holding and taking forward actions. Also agreed funding for 21-22, and again it's about our work streams, and this is one of the key points in our work streams, holding events like this and actually learning about successes. And then there is additional reimbursements that are available for task and finish leads with protected time to deliver, but that needs to be agreed in advance. But again, that's a really positive way forward, because we're doing this as part of our NHS jobs, agreed with our line managers. Full copy of the arrangements is available on our website if you want to have a look, and as I'll say at the end, I'm happy to take questions at the end of the entire session if there are any. So looking at our forward plan, I'm sure many of you have heard Carl talking about our common purpose and our forward plan key drivers. So our common purpose is in the middle here. Apologies, it's a little bit small writing. I'm not going to spend too much time on this. It's literally just to highlight. We have our 5 key drivers here, and then the 6 being underwritten by governance and communication. And these are the key things that we're working on. So supporting development of the National Clinical Audit Programme and policy. So if you want to be part of a task finish group and a new national audit or a new contract for a national audit's out, you can put yourself forward and you can be part of that and comment. Previously, I've commented on the falls and fragility audit, and it was really fascinating to be part of that process. We support training and development of staff, and you'll hear more of that as we work through and we just talk through. Support alignment of local clinical audit programs with QI and clinical audit. And it's really interesting because this is the one that really fascinates me, having a background in both research, innovation, clinical audit and NICE and QI trainer. I'm a QSA trainer. Then actually, how can we make this really be more aligned and support all of us? So that recognition of clinical audit as a QI tool. Championing clinical audit as part of that, it's a QI tool. And then engage and support staff, sharing adoption of best practice. How can we all support one another? I am rattling through this, Carl, I'm aware of time. To support those key drivers, we've got a forward plan change log that again is available on our website. The link is below there, but it shows the different work pieces we're doing. One of our key pieces of work is the Clinical Audit Awareness Week, raising awareness, having training events, making sure we're building on communication and ensuring that we've got the resources that are available for you. So if you'd like to be involved, please do get further updates from our newsletter, and you can see that we've got requests out to help support programs, or you can just contact us on nqican@nhs.net. So thank you ever so much. Happy to take comments at the end. We just want to keep to time and